Hi, my name is Julia Goar. I am a Master's of Public Health student at the University of Montana, and today we're going to be talking about childhood stunting and malnutrition outcomes in Sukadana and Simpang, Hilir, Indonesia. So just starting out with some background information, infant and child growth is internationally recognized as an important indicator of nutritional status and health in populations. So all of our health truly begins the moment that we're born. Stunting, wasting, and being underweight are the indicators used to measure child growth and reflect nutritional imbalances resulting in undernutrition. I think this image is really powerful because it physically shows the difference that you can see in kids that suffer from malnutrition outcomes. So some definitions: stunting is being 2 standard deviations below the World Health Organization growth standards median for height for age. Wasting is the same thing but weight for height. Underweight is the same thing but for weight for age. So here's a graph I think is pretty helpful. So this is the World Health Organization standard graph, and the green line is where kids should be, and the red line underneath it is 2 standard deviations below. So this is going to be the cutoff for all the malnutrition outcomes. This is length for age, so this is the cutoff for stunting. This is weight for age, so the green is where we should be, and then the red is the cutoff for being wasted. And then this graph shows weight for length. So the green line is where we should be, and then the red line below it, 2 standard deviations, would be the cutoff for being underweight. All of these graphs are for girls from birth to 2 years, but there are also graphs for boys and for the older age range up to 5 years old. The World Health Organization has cited Indonesia as one of 5 countries that have child stunting rates higher than both the regional and global averages. So here's a map of Indonesia. It is an island nation in Southeast Asia, and that little yellow dot is where I was when I was doing this research project. So Indonesia's national stunting rate is 36% of children under the age of 5, making this a priority issue for the government as well as clinics across the country, including Alam Sehat Lestari or OSRI, the clinic that I worked with in Sukadana on the island of Borneo. And here's a picture of the clinic kind of nestled right up into the rainforest there. So some more background on stunting. So throughout this presentation, we're talking about malnutrition outcomes, but we're kind of emphasizing stunting just because those rates are so high in Indonesia. So a little bit more about it. So being stunted results in both immediate and long-term consequences, including an increased risk of childhood morbidity, mortality, infectious and non-communicable diseases, poor cognitive development, and reduced physical productivity and economic capability. Such growth faltering often begins between 4 and 7 months of age and is accompanied by high prevalence of anemia and coexisting micronutrient deficiencies. Furthermore, research has shown that after 2 years of age, it is difficult to reverse the effects of childhood stunting, and after 5 years, it's virtually impossible because you can't make up that deficit in growth anymore. So the aim of this study was to inform a prevention program that the clinic could implement, and it was hopefully going to be based on information we could capture from the community that they serve. So we needed more information about the causes of these malnutrition outcomes, specifically stunting, to make an evidence-based intervention. So there are many causes to childhood stunting. You might kind of knee-jerk assume, oh, it's all because of nutrition, which is true, but there are other causes as well, like, maternal issues. Was the mama sick during pregnancy? Not just food as far as are you getting enough or is it nutritionally sound, but also when are you starting feeding your kids? And then breastfeeding as well, initiation and continuation, and then co-occurring infection in the children. So specifically diarrhea, respiratory, and fever can really have effects on growth. Then across the bottom, just some kind of societal and overarching issues like poverty or access to healthcare. These are things that we always consider in public health when we're looking at a disease. So methods. We implemented a health assessment survey in 15 villages within 3 public health centers, or puskesmas, in the Sukadana and Simpang Hilir subdistricts, as well as 1 day of sampling of visitors within the clinic because they were having a vaccination day. 6 surveys were collected at the clinic, and 7 surveys were implemented by an OSRI staff member in each village within the Simpang, Hilir, and Sukadana subdistricts, totaling 115 children from 110 mothers. Mothers were surveyed to measure differences in a lot of those factors we were talking about before. So household factors, access to quality health care, issues during pregnancy, maternal and child health, breastfeeding, complementary feeding, and then, of course, the quality of the child's diet. And then to measure malnutrition outcomes, we measured the age and the height and the weight of each child, because those are the biomarkers we use to determine malnutrition outcomes. We had a rich variety of results, but a few kind of stood out above the rest. Smoking and respiratory illness, child feeding, and then maternal nutrition. So just to start out, 56% of the kids that we sampled had a malnutrition outcome. So 23% were stunted, 27% were wasted, and 27% were underweight. And a combination of those was quite common. Table 2 shows us malnutrition outcomes stratified by respiratory concerns. So I kind of grouped together so you could see smoking exposure in the home, mothers with cough during pregnancy, and children with a cough within the last month. And you can see stunting and being underweight. These rates were a lot higher in kids that were exposed to smoke, kids whose mother had a cough during pregnancy, and children who had a cough in the last month. It didn't seem to have quite as much of an effect on wasting, but definitely stunting and underweight. So it kind of paints an interesting picture there. Another interesting one was supplemental diet. So the 2 factors we're looking at over to the left is when kids received liquids or food other than breast milk, and when kids first received solid foods. So under 6 months old, you should only be having breast milk, formula if needed, but definitely a liquid diet. And you can see that some kids were having solid foods under 6 months old, and some kids were getting liquid foods other than breast milk. And this included water and juice and other things. And you can see again that the stunting and underweight rates were a lot higher, especially with the receiving the foods under 6 months, the solid foods category. It's a 50% difference in stunting. Another interesting thing that showed up in the data was mothers' beliefs on food and nutrition during pregnancy and during breastfeeding. So you can see off to the left, there's all these different foods that mothers believe they should avoid to prevent the illnesses kind of across the top. So they mentioned convulsions in their kids, also luge or weak disease, and then general or not specified. What's interesting about this is the luge and weak disease was also something they described stunting. And so a lot of mothers didn't really see stunting as an issue. They weren't really sure of the causes, but they often called it a weak disease. So this led me to think, okay, moms not only convulsions, but are also trying to prevent stunting through cutting out these foods, which is a little counterintuitive because if you think about Indonesia being an island nation and Sukadana being a coastal community, if you're cutting out all these fish and these different vegetables, corn, mustard greens, and different fruits as well, how much calories and how many of your basic core nutrients are you cutting out that you would have usually been getting during a very critical time, pregnancy and breastfeeding. So what can OSRI do to address childhood stunting and malnutrition outcomes in their community? Community education, for sure, focusing on tobacco cessation, breastfeeding, and nutrition. Policies and procedures within the clinic to support patients in smoking cessation and best breastfeeding practices. And then partnering with Pukesmas community health centers to continue education and monitoring outside of the clinic. So what is the significance of this project? So childhood stunting and malnutrition outcomes are of serious concern in Indonesia, and they lead to long-term health effects that, if they're not addressed within the first few months of a child's life, they're extremely difficult to reverse. So I think having evidence-based interventions in Indonesia is something that Osri Clinic made a huge priority, the government's making a huge priority, and I think other institutions can definitely work on this in the future. This study was the first of its kind within Osri Clinic, so Osri had not yet taken any preventative measures to combat stunting and malnutrition outcomes, which is another reason that they wanted something evidence-based and tailored to their community. And then lastly, this study has forged a strong partnership between Osri Clinic and the University of Montana. And this is a partnership I hope to continue in the future as these interventions roll out and monitoring and evaluation may be needed. So thank you so much for listening to my presentation. I hope it was informative. And thank you so much for considering me for the best of Grad Con.